The other question I get all the time is, well, we've got EAP, okay, isn't that enough? And unfortunately, no, particularly when it comes to mental health care. The unfortunate fact is that very few employees actually use EAP programs. Typically, they'll have 1 to 2% utilization. And again, you got 22.8% of your workforce who has a mental health condition. So 1 to 2% utilization isn't going to do it. And frankly, the people who use those programs are often dissatisfied. Typically, they're going to have limited sessions, short sessions, sometimes audio only, and if they're not going to get the care they need, and in particular, it's not going to reduce your medical costs. So what you really need to look for is, how do I get high quality mental health care incorporated into my healthcare plan? My takeaways for the group would be, get a high quality, integrated, direct primary care provider that also provides mental health care and referrals for that tests for it and sends people to care for that. Don't count on EAP for your mental health care. Okay, it can be very good for elder care, financial management, that sort of thing, but don't use it for mental health care. Find a high quality provider, metrics based, that'll do that for you. Have open and direct conversations about mental health. And in particular, I encourage employers to send their managers to mental health first aid. It's a great program. It helps to teach managers how to talk to employees who may be struggling with their mental health and do it in the right way. And then, finally, for substance use disorder, make sure your employees are aware that there are virtual programs that they can go to that are completely confidential, fraction of the cost, and is going to help them to get better. We treat a lot of veterans, and I'm very proud of that, through Wounded Warrior Project. And we had a veteran who was being treated by his counselor, and the counselor told us this story. He said, the veteran said, "Can you excuse me for a minute?" They were doing their session, and the counselor said, "Yes, of course, happy to." And so he left the room, came back in with his 2 young sons, and he put his boys on his lap, and he said, "Boys, I'd like you to meet Mr. Brandon. Mr. Brandon is helping me." The father said, "I know I haven't been the kind of father I should have been for you, but Mr. Brandon is helping me to be the kind of father I want to be for you." And when you think about providing mental health care for your employees, okay, you're not just impacting that employee, you're impacting their entire family, their children, and the whole legacy effect going forward.